Well, everybody says there's going to be an epidemic of arthritis coming. And that's because there's 80 million baby boomers come along. They all have 72 joints, and every one of them can have arthritis, right? And so what's the problem here? Why would 80 million baby boomers get arthritis? Well, because they listen to medical doctors. They exercise, put a lot of wear and tear energy onto those joints. They told them, don't take any vitamins and minerals. You could overdose, so there's no raw materials to kind of maintain and repair. And then, of course, they say drink plenty of water. Well, you drink water. Sweat is more than water. Sweat is a soup that contains all the known essential nutrients, 90 essential nutrients, unless you're only taking in 65, and then it's worse, right? Or you're not salting your food so you can't make stomach acid, and it's not really how much you eat or what you eat, it's what you absorb. And so we have all these sort of ifs, sort of conditions that have to be met here before you get optimal amounts of nutrients in your food, you get optimal amounts of nutrients absorbed, and you get optimal amounts of nutrients deposited in the bones. Well, before we go on and tell you how we're going to do this, about July of 2002, in the New England Journal of Medicine, Harvard Medical School did a meta-study. They looked at over 300,000 people who'd gotten joint replacements from all over the world, and they said knee replacement, hip replacement, shoulder replacement, unnecessary, worthless, okay? And that's because it doesn't stop the ongoing deterioration of the bone, doesn't stop the ongoing deterioration of the joints in all the other places, right? It just takes the one joint or the two joints that they're replacing, throw them in the garbage can, and so you can't feel anything anymore, but it doesn't stop the ongoing progress of the problem, the systemic problem. And then 4 years later, the same group of doctors from Harvard Medical School looked at the backs of these people, and they said, oh, surgery for sciatica is worthless and dangerous. Don't do it. They're talking about low back pain, degenerative disc disease, restless leg syndrome, peripheral neuropathies, burning numbness in the feet, and as a result, they say don't get surgery for these problems. So what I always say is give me 90 days. Give Doc 90 days, and you are going to see one of those miracles. And basically, what's going to happen here is we are going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And to do that, you need all 90 essential nutrients. There's 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And, of course, you might need some anti-inflammatory stuff, which we can do with herbs and aromatherapy oils. And certainly might need some extra stuff if you have bone-to-bone arthritis to, again, support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. You actually have to lay down new bone matrix. It's kind of like the rebar of the bone. It's a tendon-like material before you can lay down new minerals. And, of course, you just can't take calcium. That's not enough. You need more cofactors to make it all work. Your bones are made up of all 90 essential nutrients. So I urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. So what you do to do that is you take one healthy bone and joint pack per 100 pounds of body weight. That's going to give you one jar of the CM cream to apply topically to joints for pain relief, great analgesic cream, topical use. And it's going to give you one large 240-count bottle of glucogel and one healthy start pack. So if you weigh 150 pounds to 210 pounds, I would take 2 of the healthy bone and joint packs per month. If you weigh 50, 60 pounds, I'd have you take 1 healthy bone and joint pack. If you're in a Pee Wee League, kid sort of thing, and you have a knee problem, shoulder problem, back problem, go ahead and take 1 healthy bone and joint pack, but that's going to last 2 months. For a 100-pound person, it's going to last 1 month. For a 200-pound person, give or take a few pounds, it's going to last 2 weeks. It goes by body weight. And you're going to get 245 nutrients in this package, including all 90 essential nutrients, plus the extra glucogel to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Give Doc 90 days. Let me tell you, this never fails. If you're not getting it even at the speed you wanted to, guess what happens here? This means you got to get on a gluten-free diet so you can maximize your absorption. You are not what you eat. You are what you absorb. And then, of course, there's also another possibility. No reason why you couldn't have both problems, as you've been restricting salt in your diet and you're not making stomach acid. It's very difficult to absorb minerals without stomach acid. It's very difficult to efficiently absorb B12 because the intrinsic factor won't work without stomach acid, and it's almost impossible to digest proteins without stomach acid. Your pepsin won't work, and as a result, you're going to be in a real struggle. And so you have to deal with that. Salt your food to taste. You make sure that you're going ahead and allowing the chief cells in your stomach to make your stomach acid. And then, of course, you want to get on a gluten-free diet, and you will actually allow your villi, those little finger-like projections, to rebuild, regrow, and you want to regain some of that lost absorptive surface. And, of course, this happens progressively, slowly, but surely over time if you're gluten intolerant. Get a hold of that CD, Serial Killers, and learn how it affects you and all the places that gluten is hidden. Give Doc 90 days, and you will be happy, and you won't get knee surgery, hip surgery, back surgery, shoulder surgery. What are orthopedic surgeons to do? We really care. Back after these minutes.
You may have heard about the 90 essential nutrients or the Mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Longevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine Vitamin and Plant-Derived Mineral Complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
It doesn't matter whether you're buying coffee at the Quick Mart,
Thank you very much.
grocery store, or one of those Wi-Fi equipped coffee shops. The cost these days is ridiculous.
$5, please.
If you're one of us who remember buying coffee at the local diner for a nickel or a dime, and are having sticker shock over the price of coffee these days, I've got great news for you. How would you like to own your own coffee company? We're not talking about some several $100,000 franchise investment. Longevity and its family of companies has now made it possible for you to be a coffee baron for just $10. Longevity's newest company, Javolution, can do just that. With a full range of great-tasting gourmet coffees, some of the selections also contain healthy vitamins. So stop helping those gourmet companies build empires and start building one of your own with Javolution from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate. And don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom you have for us here?
I thought we'd talk a bit about vitamin D, as I have a story here from naturalnews.com, headline, 10 symptoms of vitamin D deficiency you need to recognize. And what they're talking about here is, they say vitamin D, while still young, is good for the body in the long run. A study conducted at the University of Zurich confirmed that sufficient amounts of vitamin D taken consistently are necessary to maintain bone health. And it's sort of like I'm thinking, gee, they're just now figuring that out? But they go on to say many people believe that maintaining healthy eating habits is enough. Only few foods naturally contain sufficient levels of vitamin D, according to Dr. Heike A. Bischoff-Ferrari from the University of Zurich. So in order to get adequate levels of vitamin D through diet alone, you need 2 servings of fatty fish like salmon or mackerel every day. Thus, a necessary increase in vitamin D levels in the body through sufficient sun exposure and supplementation is needed unless you're eating those 2 servings of fish every day. They say there's a misconception about maintaining vitamin D levels through diet, and getting a little bit of ground here, as they say that since vitamin D is not a standalone vitamin, you need things like magnesium, and that's found in green leafy vegetables such as spinach. And this goes to one of the things that you often talk about. You can't just supplement with just one nutrient, because for every one nutrient that you like calcium or vitamin D, there are all these cofactors that your body needs in order to make use of that nutrient. And if you're not getting adequate amounts of that, then you're in trouble. They go on to say these 10 things are They say the flu, they say a study from Cambridge Journals, vitamin D deficiency predisposes kids to respiratory diseases. Muscle weakness, according to an expert on vitamin D, says that muscle weakness is usually due to a vitamin D deficiency. A study published in the UK discovered that vitamin D is useful in treating psoriasis, chronic kidney disease. Patients with advanced chronic kidney disease requiring dialysis are unable to make the active form of vitamin D. And they go on to say diabetes, a study conducted in Finland in over 10,000 kids given a 2,000 IU during the first day of life. They were monitored for 31 years, reduced the risk of type 1 diabetes by 80%. Asthma, vitamin D may reduce asthma attacks, according to research from Japan. And periodontal disease, they say that chronic gum disease, swelling and bleeding of the gums, you should consider vitamin D because it helps you make the compounds necessary in order to make good gums and teeth. And cardiovascular disease, congestive heart failure is associated with vitamin D deficiency, according to Harvard University. Schizophrenia and depression have been linked to a vitamin D deficiency, and cancer. According to Georgetown University Medical Center, connection between high vitamin D intake reduced the risk of breast cancer. And according to the Association for Cancer Research, they say increased doses of vitamin D are linked to a 75% reduction in overall cancer and 50% reduction of tumor cases. So vitamin D to win.
Well, you're exactly right. And this is a bad habit that the medical system has, is they cherry-pick nutrients. They'll give somebody 50,000 international units of vitamin D per day. And, of course, that's enough for a month's supply. And basically what happens here is they're getting all this vitamin D and no place to go. In other words, they're going to a party and nobody to go with, as you point out. And the problem comes in, you need 89 cofactors for it. And the reason why every American is vitamin D3 deficient is because of medical doctors. Vitamin D3 deficiency is a physician-caused disease. Don't eat any egg yolks. No red meat. Eat lots of beans, right? Oh, yeah. No butter. No cream. That's where all the vitamin D was stored. And be sure you wear long sleeves, skin blocker, sun blocker, big hats and gloves. Stay out of don't even go in the moonlight without a big hat. You're going to get skin cancer. So everybody in America is vitamin D3 deficient result. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's go to Michigan. And Pam, you're on with Dr. Wallach.
Hi, Dr.
Hello, Pam,
Wallach.
you're on the air. Hi.
Hi, Dr. Wallach. Thank you for taking my call.
Mm-hmm. How can I help you?
Thank you so much for all the work that you do. You are so wonderful. I appreciate it.
Thank you. Very sweet. How can I help you?
I have a friend. She's 66 years old, 165 pounds, and she has cataracts, glaucoma, arthritis, partial seizures, a herniated disc in her back. They want to do surgery, irritable bowel, left foot drop, weak bladder, high blood pressure, and high cholesterol.
Okay, would you run down that a little bit slower? One more time. I got most of it, I think, but I don't want to miss anything.
Okay, cataracts, glaucoma, arthritis, partial seizures. She's not able to talk and control her reflexes. Herniated disc in her back, a left foot drop, irritable bowel, weak bladder, and high blood pressure and high cholesterol.
Okay, do you know the cholesterol number?
Oh, I don't.
Okay, because my low is usually, they're high, right?
Mm-hmm.
So anyway, okay. Yeah, IBS. The reason why she has so many problems here is because she's not absorbing nutrients. When you have IBS, irritable bowel syndrome, you have a gluten intolerance. And how old is she again? She's 60?
66.
56, okay, yeah. Well, she has been gluten intolerant from the time she was an embryo and from the moment she was born. And do you know how many children she has?
One child.
Okay. Do you know if she had any miscarriages?
No.
Okay. And this one child, do they have any health problems?
I think that she takes a metformin.
Okay, for diabetes.
She
okay.
had always, ate a lot of noodles and stuff like that. I don't know of any other health.
Yeah, see, because if the mom has IBS, irritable bowel syndrome, gluten intolerance, the kids have it. So I'm sure the daughter has gluten intolerance too. So you want to pass this information on to the daughter.
Okay.
Anyway, here we need to go. No sugar, obviously, because you got a sugar problem. Okay, well, hang on. We're going to run to one of those message moments. We'll come back. Get your pen and paper ready. We'll fix her diet up, and then we'll give her a supplement program. and we're going to help this girl. We'll be back after these messages. Okay, Doug, we're going right back to Michigan and Pam. Here we go. Okay, so anyway, we need to get rid of all the bad stuff for this girl. Absolutely no fried foods, no processed meats with nitrates and nitrites. It means no deli slices, no sandwich meats. Absolutely no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, canned meats, sausage and hot dogs, all that kind of stuff's got to go. No gluten, no wheat, barley, rye, or oats. I urge you to have this lady, Pam, listen to that CD, Serial Killers. I mean, gluten is hidden in everything. Dog food, bologna, salami. They use it to thicken soups. Even chicken rice soup. You think, well, what could be wrong with chicken rice soup? Wheat dust is found in nuts in a bag, and so it's everything, every place. You got to listen to that CD, Serial Killers, and find out all the hidden places. And then at 165 pounds, I'd have her take 2 of the healthy bone and joint packs, 2 of the healthy bone and joint packs that will allow her to relieve some of the pain of her arthritis with the CM cream topically. She's also going to have the ability to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that is going to be accomplished by the 2 healthy bone and joint packs, and they're going to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, matrix, bone itself. Now, the high blood pressure, I also wanted to have the ultimate daily tablets. I wanted to have 3 twice a day. That's 1 bottle a month because it's a big bottle. It's going to support healthy blood flow through plugged arteries and actually support and promote healthy blood pressure. Also, it's going to get blood flowing through the small blood vessels of the eye and support healthy eye pressure. And then we have cataracts. I want her to also have 9 selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. That's 3 bottles a month of the ultimate selenium. Cataracts are free radical damage to the proteins in the lens, so that's why we've got to get rid of all these free radical things and then actually support the body's immune system so we can help support and promote maintenance repair of these injured tissues. Now, the back problem, let's see here, the bladder problem can be due to the disc problem. Where you have an irritable bladder kind of thing. This could be peripheral neuropathy, kind of like a sciatica of the bladder is very common because of the disc problems and arthritis. And so I'd have her take those 15 glucogel a day, which we've talked about. And the cholesterol should run 220 to 270. It's always good when people call me, they say they got high cholesterol. I need to know the numbers. If she is on cholesterol-lowering drugs, I'd have her get off of those. They will contribute to her seizures. I'd also throw in 3 of the Smart FX 3 times a day, 3 bottles a month. That may help her with the seizures. Call me every 2 weeks on this, gal, Pam. We'll be back after these messages.
Let's head to South Carolina, and Jim, you're on with Dr. Wallach.
Well, hello, Jim. It's been a while. How you doing?
Hello, Doc. Had a good squirrel season this time. Killed over 35, so we're not running out of squirrel and dumplings right yet.
Okay. Nothing better than squirrel and dumplings.
Yep. I met you back in Myrtle Beach in 1996 when you were just starting.
Yep.
Anyway.
Appreciate that.
I sailed past 79 here last month, and I'm still loading boats and shooting squirrels and raising sand. Got 2 fellas I want to talk to you about. One had a kidney problem, 81 years old, 160 pounds, 5 foot 9 inches. I got him on...
wait a minute, is he on kidney dialysis?
No. Okay. Just declining kidney function.
Okay, go ahead. Tell me what you're doing.
All right. Anyway, I got him on Herbal Rainforest, Beyond Tangy, Osteo FX, Rebound, Trion, Glucogel, Oxybody, Selenium, Sweeties, and the EFAs. and I just started him on the Ultimate Daily.
Okay,
but anyway,
super.
Let me give you his numbers. Jot these numbers down from his blood work on the kidneys. Jot these numbers down. Bun, B-U-N, 24 rather. Yeah.
Okay.
Bun, 24. Creatinine, 197.
Okay.
EGFR, 32.
What's his blood sugar? His glucose.
Let me look.
And his cholesterol. Those are the only two I want now.
I don't see a blood sugar, but I got a serum glucose.
Okay, that'll do.
89.
Perfect. Now tell me what his cholesterol, total cholesterol is.
Don't know. It's not on this. This blood work was just done on primarily on
lab
kidney.
Yeah. Okay. All right. So at any rate, basically, you're doing exactly the right thing in adding. That's the only thing I would have added to the program you started with is the Ultimate Daily tablets, because when you have declining kidney function, and while 1.97 for creatinine is a little high, I've seen them as high as 5 and 6 and 8, and these guys are in trouble. And this guy has plenty of repairable kidney. And in fact, most of the time, there's nothing wrong with their kidneys. What happens is they get blockages of the small arteries that carry the dirty blood into the filtering units called glomeruli. And so there's little or no kidney function because it's not getting any of the dirty blood. Once you open up those little arteries and get blood flowing through them, then the kidney begins to function again, and people are able to get off of dialysis or prevent getting on dialysis. So he's at that point where we're going to help him prevent getting on dialysis, and we're going to support and promote healthy blood flow to those little, what's called afferent arteries. And what does he weigh? You said 160 pounds. Yeah, I'd be sure that he's taken at least 6 a day of those Ultimate Daily tablets, 3 at breakfast, 3 at dinner. If he's producing lots of urine, it wouldn't hurt to give him 9, 3 at breakfast, 3 at lunch, 3 at dinner. That'd be 2 bottles a month. Okay, individual number 2.
Okay, 79 years old, 152 pounds, 5'6". About 4 or 5 years ago, diagnosed with a tumor which was diagnosed as a sarcoma and was checked out as benign. And the size on it back then was about 3/4 of an inch high by 1.5 inches in diameter.
Okay, where was this tumor located?
On the neck.
Okay, was this on the bone or under the skin?
No, just under the skin.
Yeah. Okay, well, yeah, if it's benign, it could be one of those fatty tumors. A lot of times people get irritation from collars and the neck bands on like T-shirts and things. If they don't double rinse their clothes or they use a harsh detergent, it'll cause inflammation of the fat tissue underneath the skin and can cause lipomas, which are benign fatty tumors, usually the size of a large grape. Sometimes they're flat like a lima bean. And usually if they're not causing any problem, like a paralysis or numbness or an open wound or something, it's better just to leave them alone. They don't cause any problems, and you don't want to risk infection, this, that, and the other. But what I would do is, this guy needs to have all 90 essential nutrients according to his body weight, so at 152 pounds. I'd have him take 2 Healthy Start packs a month. That's 1 ounce of the OsteoX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses twice a day, and then all that would be taken care of by the 2 Healthy Start packs. Wouldn't hurt to throw in 2 selenium twice a day, 1 bottle a month. And then give me a call every once in a while. Let me know how these guys are doing. Don't wait so long, Jim. We miss you. Okay, Doug, let's go to callers.
Let's head to Southern California. And Kevin, you're on with Dr. Wallach.
Okay, is that Kenneth? Was it?
No, it's Kevin.
Kevin. Okay, Kevin. I'm sorry. Okay, Kevin, how can I help you?
Yeah, okay. I just had an aortic valve replacement due to, a bicuspid valve. Mm-hmm. Actually, it turned into a tricuspid valve. It was so bad that I guess that if I didn't get it, I didn't have the inverted heart rate that I had, that I would have had a massive stroke and died, is what they told me. It was one of those situations that, they couldn't, unless I specifically tested for it, then they never would have known until an emergency situation. But eventually, now I'm going to be on Coumadin, metoprolol, and Lipitor, and I want to get into a situation where I can start getting into a healthy diet and supplementation and, get better in life, because a piece of the calcification did go in my retina and did give me partial blindness as well.
Okay, what do you weigh, Kevin?
I'm at 180 right now.
And how tall are you, sir?
5'7".
All right. Any other issues I need to know about? Diabetes, high blood pressure, arthritis?
Nothing yet that I know of, because, like I said, it was all kind of an emergency situation that I went in there with an inverted heart rate, and I just found out that there was so much calcification that I had to get the valve replaced, and I just got it replaced about 3 weeks ago. And so the doctors are just saying, hey, you know what? Let's give it another more month, and then we're going to reevaluate you with everything. So
sure. Okay, well, hang on. We'll be back. Go get your pen and paper ready. I'll give you a diet, and I will give you a supplement program to support healthy heart and blood vessels. We'll be back after these messages. Back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 9 for Life Crusade. And Doug, let's go right back to California and Kevin. Okay, 180 pounds. You need to give up all the bad stuff to stop the ongoing damage to your cardiovascular system, maybe other tissues also. Certainly nothing inflammatory, no fried foods, no processed meats with nitrates and nitrites, no oils, it means no margarines, mayonnaise, salad dressings, cooking oils. Eat canned fish, you got to be packed in water, mustard, tomato sauce, not oil. No gluten, no wheat, barley, rye, or oats. I would also have you take 2 healthy start packs per month, 1 ounce of the Osfex Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 healthy start packs per month. Then I'd have you take for the heart and the valves, the selenium, 3 twice a day. That's 2 bottles a month. 3 of the de-stress capsules twice a day. That's 2 bottles a month. And the Ultimate Daily Tablets, 3 twice a day. That's 1 bottle a month. And that's going to support and promote healthy blood flow through blocked arteries. It's going to support and promote healthy blood pressure levels and cholesterol and so on. Give me a call every couple of weeks. Let me know what's going on. Let me know as your tests progress, and we'll walk you through this. Okay, Doug, let's go to callers.
Let's head to Alabama. And Vincent, you're on with Dr. Wallach.
Hello, Vincent. You're on the air.
That's Anthony.
Okay, well, that's close enough. Okay, Anthony,
hey,
how can I help you?
Dr. Wallach, good to talk to you. Quick question. From time to time, I get real bad sore throat, and then it goes into a cold. And I've always had that, even when I was living up in Michigan before I moved to Atlanta and then Alabama.
Okay, well, let me ask you a couple of questions. Let me ask you a couple of quick questions here. In addition to this sort of chronic sore throat, cold scenario here, do you have a history of any skin problems, dry skin, eczema, dermatitis, psoriasis, rosacea, anything like that?
Not. I would say last year I noticed I had a small spot on my arm that was real rough, like a circle, and it's gone now. But I've never had anything going on with my skin.
Okay, well, what about did you have asthma as a kid?
No, never had.
Did you ever have belly pain as a kid, or your appendix out, anything like that?
No, none of that. Mm-mm.
Any brothers and sisters?
I do, brother and sister.
Okay, do they have any asthma or had their appendix out?
No.
Okay. The odds are with this chronic sore throat and catching a cold afterwards kind of thing, the odds are you do have a gluten intolerance. How much do you weigh, Anthony?
I would probably say maybe 230 from the last time I talked to you, about 230.
Okay, how tall are you, sir?
5'10", 5'11".
Okay. All right. So unless it's all muscle, it wouldn't hurt to lose maybe 30, 40 pounds over some time here. But also, I would have you get rid of all the bad stuff that's putting pressure on your immune system. You also want to practice good hygiene. What kind of work do you do?
Mostly driving, and now I'm getting ready to go back into a plant
Okay, so you're not a teacher working around all these sick and coughing kids all the time.
No.
Okay. All right. So, at any rate, I would definitely take 2 healthy start packs per month. That's going to give you that platform of all 90 essential nutrients, 1 full dose of each of the 3 products at breakfast and dinner. I'd have you take the Killer Biotic, 3 of those twice a day. That's 2 bottles a month. It's a blend of 8 herbs that actually support your immune system and actually kills bugs. And then I would use our colloidal silver. Make a little mist out of it or a sprayer. Put 2 droppers full in a couple ounces of water and spray that in your throat when you wake up in the morning. Spray it in your throat in the middle of the day and spray it in your throat again before you go to bed. Use our PureWorks spray or foam hand sanitizers. There's no alcohol in it. It won't dry your skin, but it will have lasting positive effect as far as killing bugs, viruses, bacteria, fungus, and yeast for 3, 4, 5, 6 hours after it dries. Purell and other alcohol-based hand sanitizers only work while they're wet. And it's kind of funny, people wave their hands around trying to get rid of it faster. And to help you lose weight, take some more pressure off the immune system, get on a dropper full of that ASAP under your tongue 30 minutes before each meal. Start out with 1 bottle a month. And call me every 2 weeks. I want to know your weight, your blood pressure. Tell me how the sore throat's going. And we'll walk you through this. Well, thank you, everybody. A superlative job, as usual, Doug and Billy. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. Again, that number is 313-444-3463. Call right now and leave your name, telephone number, or email address, and we will see to it that the right person contacts you shortly. Remember the phone number. Again, it's 313-444-3463. Again, that number is 313-444-3463. Call now to change your life. That's 313-444-3463.
Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Longevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Longevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Longevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Longevity has been helping people overcome their health challenges for for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Longevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Longevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Longevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities.
This is a healthcare alert from the Pain Relief Hotline. If you, a family member, or a loved one suffers from knee, back, shoulder, or ankle pain and have Medicare as your primary insurance, we've got great news. You don't have to suffer any longer. You can immediately qualify for a pain-relieving brace at little or no cost to you by calling our 24/7 Pain Relief Hotline at 866-389-0620. Delivery is free and all paperwork is handled for you. If you are on Medicare and have knee, back, shoulder, or ankle pain, don't wait. You can qualify to immediately receive a pain-relieving brace at little or no cost by calling our 24/7 Pain Hotline now at 866-389-0620. Our representatives are standing by 24/7 to take your call and rush you your pain-relieving brace at little or no cost to you. Shipping is free and all paperwork is handled for you. Just call 866-389-0620. That's 866-389-0620. Again, 866-389-0620.
Owe $10,000 or more to the IRS?
Get on board with the Tax Admiral. Don't take on the IRS alone. I'll cut penalties and reduce your overall tax bill. Sometimes I can even get it zeroed out completely.
We're an A-rated company helping people clean up their mess with the IRS.
If you owe $10,000 or more, then call the Tax Admiral.
Call 800-287-7180. Again, that's 800-287-7180. 800-287-7180.
Most of us already know that taking a fish oil supplement to boost omega-3s is a good idea. But did you know that about 60% of Americans are actually deficient in omega-3s? Did you know that most fish oil products contain only about 25% omega-3s and the remaining 75% is undesirable fish fat? Heck, did you know that more than 90% of fish oil supplements sold in the USA are not even made here? If you want to boost your omega-3s using the finest American-made fish oil, check out Nutrigold Fish Oil Supplements on www.fishoil.best. Nutrigold fish oils are independently 5-star certified and guaranteed to be exceptionally pure. That means no more fish burps. Best of all, just one Nutrigold fish oil capsule contains more omega-3s than 4 standard fish oil capsules. Go to www.fishoil.best or call 888-920-1497 and use promo code BESTFISHOIL to get a free 1-month supply. That's www.fishoil.best or call 888-920-1497.
This is Dan Pilla. Do you owe the IRS money you can't pay? Are tax debts crippling you? I've defended people from the IRS for over 30 years. I've helped thousands, and I can help you too. I wrote the book on IRS settlement, and I'm telling you, there's no such thing as a hopeless case. Call 800-34-NO-TAX to finally get free of IRS debt. With the IRS's new programs, there's never been a better time to solve your problem. Call 800-34-NO-TAX. That's 800-34-NO-TAX or my website, danpilla.com.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. Again, that number is 313-444-3463. Call right now and leave your name, telephone number, or email address, and we will see to it that the right person contacts you shortly. Remember the phone number. Again, it's 313-444-3463. Again, that number is 313-444-3463. Call now to change your life. That's 313-444-3463.
Paid non-attorney spokesperson Adam Pulaski of the Pulaski Law Firm with principal office in Houston, Texas is the attorney responsible for the content of this ad. This ad is not legal advice, and the choice of a lawyer should not be based solely upon advertisement. Services may not be available in all states. Attention Xarelto users. If you or a loved one took Xarelto and suffered a serious bleeding event, you may be entitled to financial compensation. Xarelto is a popular prescription blood thinner used to prevent blood clots and protect patients from strokes. These serious bleeding events have led to numerous cases of hospitalization and even death. Phone lines are open 24/7. Call 800-261-0937. That's 800-261-0937.
Do you owe $10,000 or more to the IRS?
Then get on board with the Tax Admiral and let us steer your way to financial freedom.
The IRS is the largest collection agency in the world. They can freeze your bank accounts, seize your car, home, will garnish your paychecks and benefits.
Don't take on the IRS alone. I can fight for you using industry secrets that can help stop the IRS. I'll cut your penalties, slash your interest, and reduce your overall tax bill. Sometimes I can even get it zeroed out completely.
We're an A-rated company with over 30 years experience helping people clean up their mess with the IRS. And we have a 95% customer satisfaction rating.
If you owe $10,000 or more to the IRS, are facing an audit, a lien, or levy, then call me right away.
Call 800-287-7180. Again, that's 800-287-7180. 800-287-7180. 800-287-7180.
Are your Google search results killing you? Unflattering content in blogs, news articles, online reviews, social media, or other sources can jeopardize your reputation, your business, and your livelihood. Let Reputation.com help. Our patented technology will make the truth about you more visible while pushing down unwanted negative content. Improve your Google search results. Call Reputation.com at 1-800-831-0771 for a free consultation. That's 800-831-0771.
We use mobile devices right against our bodies every day, but growing scientific evidence has emerged showing serious health risks associated with exposure to EMF radiation emitted from these devices. The solution is Defender Shield, the most effective mobile radiation shielding ever developed. Defender Shield blocks virtually 100% of EMF radiation from cell phones, tablets, and laptops, and starts at just $64.99. Buy now at DefenderShield.com. For 10% off, use promo code GCN. DefenderShield.com, the worldwide leader in mobile radiation shielding.
Paid non-attorney spokesperson Adam Pulaski of the Pulaski Law Firm with principal office in Houston, Texas is the attorney responsible for the content of this ad. This ad is not legal advice, and the choice of a lawyer should not be based solely upon advertisement. Services may not be available in all states. Attention Xarelto users. If you or a loved one took Xarelto and suffered a serious bleeding event, you may be entitled to financial compensation. Xarelto is a popular prescription blood thinner used to prevent blood clots and protect patients from strokes. These serious bleeding events have led to numerous cases of hospitalization and even death. Phone lines are open 24/7. Call 800-261-0937. That's 800-261-0937.